If you haven't yet registered for the rest of this series, go ahead and do that, and make sure that you're joining in and being able to be familiar and grounded in how we can support all of these different people while we're doing our mobile crisis. All right, so today we have Alex who is joining us, and he is a subject matter expert on the LGBTQ community. So Alex, would you like to introduce yourself, please?
My name is Alex Filippelli, he and they pronouns. I work with CARS, a project director of the LGBTQTA Center, which is another one of our projects. We support LGBTQ centers across the state of California to implement and evaluate culturally responsive prevention and mental health intervention, prevention and early intervention mental health programming. Prior to that, I worked at the Gender Health Center in Sacramento, which is a transgender-led, transgender-serving nonprofit. And there I worked in various capacities, but I served folks, primarily trans folks, but LGBTQ folks as well, in prevention, in treatment, in connections to care, and in crisis work as well. And I have a lot of experience doing workforce development, mostly helping health systems, universities, and community organizations support their trans employees or client patients as well. So I'm really excited to be a guest here with the M-TAC team and to work alongside Erin. This is our first time working together. So yeah, it's great to be here and be in the company of so many people who
This
are
is not
committed to
working.
saving lives. Thank you.
So we're very fortunate to have him joining us today with his wealth of knowledge. And as you guys know, for the last 16 years, I've been part of mobile crisis teams, either as a responder, a supervisor, or a manager. So together with our wealth of knowledge, then, we're going to have an excellent training today. So I'm super excited to hear everything that we get to go through. So as always, this presentation was prepared for the M-TAC project, which is funded by DHCS and administered by CARS in collaboration with AHP. So the views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of DHCS, CARS, AHP, or M-TAC. All materials appearing in this presentation, except for copyrighted resources, is in the public domain and may be reproduced or copied without permission. However, if you are going to use that, we appreciate a citation, and please do not reproduce and distribute for a fee without specific written authorization from M-TAC. And as you guys know, this meeting is being recorded today and will be saved on our M-TAC website for future use. And California land acknowledgement. So as we are spread out across up and down California, we acknowledge that the virtual training is taking place through the unceded territory of California, which is home to nearly 200 tribal nations. As we begin this event, we acknowledge and honor the original inhabitants of our various regions. Where I'm at today, I am in the region of the Serrano Nation. A land acknowledgement is a critical step towards working with Native communities to secure meaningful partnerships and inclusion in the stewardship and protection of their cultural resources and homelands. So please, let's take a moment to honor these ancestral grounds that we are collectively gathered upon and support the resilience and strength that all Indigenous people have shown worldwide. Today, we are going to be reviewing culturally responsive care in LGBTQ communities. Alex is going to be taking most of the lead on this, given his subject matter expertise, and then I get to chime in with all of the mobile crisis stuff. So we are going to have a fun session today. We get to understand the concepts of cultural humility as it relates to the LGBTQ folks, understand intersectionality and how that's important when we're going out into the field and working with people, that we're not just working with somebody who identifies as one type of person or one thing or one identity. We get to learn communication techniques that support LGBTQ communities and is affirming to their care. We get to identify some of the challenges that LGBTQ folks have in accessing care in the crises that they're involved with. And then we will learn practical steps as mobile crisis responders, how we can support and empathize and respect and advocate for this population. And in our agenda, we're going to be first looking over mental health. Next slide, please. Mental health in LGBTQ youth, the LGBTQ identities, cultural competency, humility, trauma-informed care. And then specifically as mobile crisis responders, what we can do to support. All right, thank you. So why is this important to us as mobile crisis responders? So understanding that suicide is the second leading cause of death among young people and people who identify as LGBTQ. So in young people who identify, they are 4 times more likely to seriously consider suicide, to make a plan, and to attempt suicide than their non-LGBTQ peers. So as mobile crisis team members, we get to understand the challenges, the barriers to care that they face, and we get to support in serving them and getting them linked up to appropriate care and making sure that we're saving lives that are very, very fragile and very vulnerable. So specifically, what we're going to be learning today is how to use LGBTQ affirming de-escalation techniques, how to recognize gender affirming support through family mediation, how to appropriately access LGBTQ responsive and respectful care, and how to like role model and advocate for LGBTQ folks out in the community to make sure that they're not being re-traumatized, that they're not continually being hurt out in the world as we're linking them to the resources that can save their life. All right, and so right now we're gonna have a Mentimeter question. So the question is, what fears or concerns might someone who identifies as LGBTQ have when engaged with mobile crisis support? So for those of you who have gone out and worked with somebody who identifies as a member of the LGBTQ population, have you noticed anything that they may be less willing to volunteer information? Maybe they don't want to be as open to their family. What have you seen out in the field when you're working with somebody who identifies in the LGBTQ population? Isolation, absolutely. Yeah, sometimes, especially with youth, feeling very much alone, maybe that they're the only one who they know who identifies as gay or who identifies as transgender. Maybe they don't have anyone else in their world that identifies that way. Fear of discrimination. Yep. I know for myself, I do identify as gay, and that was one of my challenges growing up, is that people would hate me without ever knowing me. And so that was one of my big fears growing up. Shame, mistrust, anger at discrimination, lack of support, fear of being outed. Absolutely. These are real fears and real traumatic events. And so when we go back and think about the 4 times more likely, all of these things are kind of making sense, right? Fear of losing family and friends. That is a real true fear. People get kicked out of their home if their family is not accepting, not comfortable sharing their sexual orientation, discrimination, fear of losing a bond with loved ones. Thank you for putting that in the chat. Misgendering. Absolutely. So I think we can collectively see how important it is that as we're going out and responding to folks who are members of the LGBTQ community, that we do it with respect, that we go out there with cultural humility, that we're being present for them. So yeah, thank you so much. So Alex is going to be talking with us about some of the specific challenges that we're seeing in LGBTQ youth and in LGBTQ adults as well across the population.
Thank you so much. Great. Thanks, Erin. So to get us started off, we're going to look at some recent statistics that are alarming, but hopefully everyone is familiar with the Trevor Project. If you're not, they're an excellent research for LGBTQ crisis support. And also, they produce a lot of really useful research. So definitely a great initiative to be aware of. And in a recent study that they conducted of youth across the US ages 13 to 24, here's some of their findings. Okay, and so what we can see is that suicide, and Aaron's already mentioned this, is the second leading cause of death among young people, and LGBTQ youth are 4 times more likely to seriously consider suicide, to make a plan for suicide, to have an attempt for suicide than their straight and cisgender peers. It's and that number is even higher for trans and non-binary youth. And so it's important for us to understand how prevalent these attempts are if we know that we're responding to an LGBTQ youth, or when we become aware that someone is LGBTQ, that the likelihood that they may make an attempt is significantly higher. And that's compared to 10% of the overall high school youth population. And this study also shows that LGBTQ youth of different racial and ethnic backgrounds have different rates of attempting suicide as well. So it's important to keep in mind that LGBTQ youth are not a monolithic group, that there's a lot of diversity in and amongst that makes up who we are, and that the LGBTQ may also not be, like, if someone's queer or gay or transgender, that might not be the most important or only like identity factor that you should be thinking about. And then we can see from the third point as well, the impact that recent politics have had on youth mental health. And so when you're working with youth, please just keep in mind that youth are a whole person, and that they're situated in an environment with meso and macro factors as well, right? That folks are in relationship with their family, their school communities, and also the culture and the political climate. And currently we are in a political climate that's openly hostile towards LGBTQ people and transgender youth in particular. And so that we need to be thinking about that and keeping that in mind as we're assessing risk factors, and then also conceptualizing case planning and safety planning. There is a clear relationship between LGBTQ youth who have unsupportive family, and then youth subsequently experiencing mental health challenges. And so we need to keep that at the forefront of our minds. And LGBTQ youth experience higher rates of anxiety and depression, higher rates of harassment and violence, higher rates of substance misuse, homelessness, et cetera, et cetera, et cetera. And as I'm sure you all know from your work in the field, that it's extremely difficult to disrupt these cycles once they've begun, right? That it's much easier to prevent someone from becoming homeless or engaging in problematic substance use than it is to like get them the care they need, and for that cycle to not repeat, right? So we need to also understand, and I'm sure you already experience so many constraints in your work. There's so many challenges and barriers connecting anyone to systems of care, right? Those challenges are exacerbated when we're working with LGBTQ folks, that the systems that are designed to help may very well exacerbate a crisis. It could be things like treatment centers or homeless shelters or other like housing or support services are gender segregated, right? This is a women's only program. This is a men's only program, right? It could mean that like the program requires the name and gender and like the sex that's on people's identity documents has to be what is used in their registration, and it's then what's on all of the paperwork, and that's how that person is going to be referred to, right? Or it could mean that there's like a rooming policy, that a transgender person is placed in segregation or in isolation for their own protection, right? But actually that can have really negative impacts on those folks that are being placed there for their protection. So those are just some of the, and then and because of that rooming policy, there may be an additional barrier, a wait time to get into care. So all of those things can be challenges. So it's important that we think about ourselves as advocates as well as crisis responders, that folks may need support navigating these barriers to care and then mitigating the harm that these systems can perpetuate. And so it becomes even more like, and I'm sure in your work, it's already important that you have relationships with folks at other agencies and in programs and in the schools and other public services, but it becomes even more important that you also understand where how folks are LGBTQ youth are treated, or adults are treated when they are referred to these different programs or services, if there are LGBTQ specific services that exist in your community, and how to facilitate warm handoffs that also include different affirming strategies or things that you know about the young person that you can do to support them in having a better experience in care. And here we're just going to hone in a little bit more on family acceptance. So here's some recent data that's out of the Family Acceptance Project that is at San Francisco State University. And they also have such a wealth of resources and toolkits, research, everything. They're so great. What they have found in their research is that stress and non-supportive home environments has immediate mental health challenges for young people, right? And then they start experiencing all those poor outcomes that I've already named: mental and physical health, higher rates of substance misuse, violence, homelessness, et cetera. And those differences, they continue from a young person at that point in time across their lifespan. There's also really important research out of Family Acceptance Project that shows that just a small decrease in rejecting behaviors and a small increase in accepting behaviors can have a significant impact on improving mental health outcomes for young people. So when you're working with young people, you're often always working with their families or their guardians or, you know, whomever, right, is supporting them and caring for them. It's really important that their caregivers understand the very real impact that their behaviors have on their loved ones. And it's important that we encourage immediate and incremental changes. So, you know, a guardian, a caregiver may be very resistant to using names and pronouns that are affirming, or maybe they don't like their child dressing in clothing of a different gender, or they don't like that their hobbies and interests or their mannerisms don't align with the gender norms that are expected for someone based on their sex assignment at birth, right? If they're a boy or a girl. In this case, it's really important for parents to know, or guardians and caregivers to know, that even just a small reduction in those rejecting behaviors, just getting pronouns and names right some of the time, or just saying nothing instead of saying something negative, can have a real impact. And so incremental change is not the end goal, but it can make a difference in the meanwhile. And I really encourage folks, and when I work with parents or caregivers, I'm really honest about these disparities and the reality and the very likely outcome that exists for LGBTQ youth that are not affirmed in their home environments. Because parents, I think, you know, are probably thinking about like their expectations that they have, or wanting their young person to succeed. And that includes conforming to certain norms around gender and sexuality and those kinds of things. But what they're not thinking about is that they want their young person to not exist, right? And so bringing that reality into the conversation, as sad as it is and as upsetting as it is, it does definitely, it can be really meaningful in shifting how parents are thinking about some of the more subtle and nuanced, but really normalized ways that they might be conveying their disapproval or open disapproval of a young person's gender or sexuality. And as of course, we always want to engage families in our parents and family members in safety planning. So we really want to be transparent so that they know what the risks are. Okay, so now we're going to look at some foundational concepts and terms that pertain to LGBTQ identities. So we may have thought about gender identity or sex or sexual orientation as a binary. That's one way that they are commonly understood. This model from the Trans Student Equality Resources Center presents these concepts on spectrums, Okay, so it's a bit more of an expansive way of thinking about those. So this model presents 5 concepts: gender identity, right? That's a gender expression, sex assigned at birth, sexual attraction, and romantic attraction. Sometimes this can be thought of as 3 concepts, where like gender identity and gender expression are one. Maybe they're even the same as sex assigned at birth. And then sexual and romantic attraction are also collapsed. And it's assumed that, a baby's born, somebody like a medical provider looks at that baby, looks at its genitals, makes a determination, right? It's a girl, it's a boy, and that baby will then grow up to, if assigned female or a girl, be feminine, you know, get married, marry a man, have children, be heterosexual, etc. And like vice versa, right? And so that's what I mean about them being binary. Here we're going to think about them in a little bit more of an expansive way. So gender identity is what's in our head, how we think about ourselves. We may think about ourselves as like a girl or a woman or a man or a boy, or maybe another gender, right? If we're not a cisgender person, and I'll define that term in just a moment for you, but maybe we think about ourselves as like gender fluid or gender nonconforming, or like not really fitting into one of those 2 categories. Gender expression is what we present, or how we present ourselves to the world, right? We might present ourselves as feminine or masculine or a combination of both, or we might, you know, femininity and masculinity, we might not subscribe to those concepts at all, right? But certainly there can be, we can think about ourselves one way, and then we can present ourselves in another way, right? And we do that with our clothing and our hairstyles and our mannerisms and our voice and our interests and hobbies and all of the ways that we express who we are, right? And then for sex assigned at birth, typically there are 2 sexes that can be assigned, right, on a birth certificate. I mean, in California, you can have an X, but intersex is not an option. Historically, it's been female or male. But we actually know that and here in this concept, we're attributing sex to biology, biological characteristics, and it tends that decision is made based on external genitalia, but there's actually a number of different ways to measure biological sex. It could be with the genitals, it could be with hormones, it could be with chromosomes, it could be combinations of different internal organs, sex organs. There's over 500 different intersex conditions that exist in human nature, and almost none of them are visible from the outside of a baby's body. Many of them reveal themselves during puberty, and many of them are never known, right? I think we could probably all recall stories in the news of a female Olympian having her medal stripped because it turned out they did a chromosome test and her chromosomes didn't match her testosterone levels and the sex that she was assigned at birth, right? And then she is in that moment being also told she's not female, right? And having her life's work taken away from her, right? So there are different ways that we measure these categories. And in that sense, they're also kind of arbitrary, right? And certainly not inclusive of the diversity of the human experience. So if a baby is assigned, has a vulva and is assigned female at birth, and that person grows up and thinks about themselves as a woman, then that would be a cisgender person, right? Same for a baby that has a penis, is assigned boy, and grows up and thinks about himself as a man. Okay. Someone who is assigned female at birth and does not think about themselves as a woman, but instead as a man or a non-binary person or some other gender identity, and vice versa, would be a transgender person or a gender non-conforming person or a non-binary person or any number of different terms that encompass what I think about as like a transgender spectrum, right? Someone who's not cisgender, living outside of those, of that container. And then sexual and romantic attraction, these are often collapsed, right? We assume that, I think dominant society might assume that we only have sex with people or only sexually attracted to people that we're also like emotionally and romantically attracted to. And when we actually look at people's sexual practices and their romantic people that they have romantic or emotional relationships with, we see that that's a very oversimplified way of thinking about these concepts. But generally, when we're thinking about sexual and romantic attraction, right, we're thinking about the rest of the acronym or like alphabet soup that is not transgender folks. We're thinking about lesbian and gay folks who are like, we could think about as like same-sex attracted. We might be thinking about bisexual folks, and bi refers to the recognition of attraction or to genders or sexes, right? And pansexual is another way of describing someone who's attracted to multiple genders and kind of acknowledges that there's more than two, right? Someone could also be asexual, so they don't experience sexual or romantic attraction, or maybe they experience romantic attraction but not sexual attraction. And then again, there's just the terms go on and on. Another one that I'll name is queer. Queer, you shouldn't assume what that means. It might be, an umbrella term, as in like I'm somewhere in that community, but it's like not really your business, or someone could use that term to refer to any one of those terms I've just already mentioned: gay, lesbian, bisexual, pansexual, asexual. It could mean I'm not straight. It's none of your business. It could mean I don't subscribe to these labels. So, and this is like by no means an exhaustive list. What's really important for you to take, like, there's a few things that are important for you to take away from this, but like you can and you shouldn't know everything, and you shouldn't try to define it because definitions are always changing. What's more important is that you know like a little bit, and like the really important thing that you know is that affirmation is de-escalation, right? So you just have to know a little bit to know that it matters that you use affirming language and approaches with the people that you're working with, and you work to build that trust, and you're consistent, because that is your gateway to de-escalation. Okay. One more concept I want to talk about that is actually not on this slide is our perception, right? And that's really key, right? So regardless of how someone thinks about themselves, how they present themselves to the world, all of us have a perception of the people around us. We're always making um, judgments or assumptions, or we have biases that are based on our cultural lens. They're based on norms of what we believe to be true about gender, sexuality, as well as like race and ability and like all of these other constructs, right? And we have to be careful to not make assumptions about someone based on our perception of them. You can't tell that someone's transgender or queer, right? Or like, I don't know, maybe you can sometime, but for every time you think you can, there's like 100 times that you can't, and you shouldn't try to figure that out. You should not assume and defer to them and their lead. And also someone was also bringing up like fear of being outed, right? And so like also someone may disclose, and then you're gonna affirming them is not outing them, right? And so that you're gonna have to navigate that as well, maybe deliberately using pronouns with some people that are not the pronouns that people. I'll get more into this in a moment. I'm getting a little bit ahead of myself. Okay, we've talked about these concepts on a binary. We've talked about these concepts on spectrums, and we can also think about them as existing on galaxies. The reality is that there's like thousands of different words that to describe gender and sexuality, and we just can't know them all. And they're way more dynamic than that, right? These concepts are fluid, they're nonlinear, and they're evolving. There's just so many different things that have changed since I came to know myself as a queer and transgender person. And certainly before I knew myself as that, the language that was available, like I didn't know that I was transgender because the language that was available for me as a youth was like looking up in the encyclopedia before the internet. And it was like, you must be trapped in the wrong body, and you must, have these like these medical criteria that were really pathologizing and outdated. And so like that was the definition of transgender at the time, right? And I was like, well, I can't be that. Like that doesn't fit with my experience, right? And so it was only much later when there was more language that was accessible to me that I came to understand myself in this way. And then it's changed a lot in that time as well. So we really need to just take a step back and be like, hey, this stuff is always evolving. It's okay to be wrong. I know a little bit about this, and like help me understand how you think about yourself and what I need to know about you and how you understand yourself so that I can create a plan to support you. Okay, getting a little bit more into language here. We used to talk about pronouns as preferred pronouns. I firmly discourage that use now. Pronouns are not a preference. Pronouns are mandatory. Talking about them as a preference, it minimizes their significance, right? It's like transgender people or non-binary have preferred pronouns, and everyone else just has these pronouns that accurately describe who they are. Well, pronouns accurately describe who transgender and non-binary people are as well. And it's important that we're accurate in our use of them because they can be life-saving, right? Affirmation is de-escalation, right? So we want to help save people's lives. We want to be accurate in how we communicate about them. These are just a few examples of pronouns. Just like I was describing with language and terms taking off, there are so many people that use so many different pronouns now. I know people that use things like fam to refer to themselves, or it's, or there's just like no shortage of terms. I do think that it can be really helpful when you hear what someone's pronouns are, is to ask them how they use it in a sentence and write it down. My practice is when I meet people is I always write down their name and pronoun, like if it's a group setting, like where they're located in the room so that I can reference that. And before I communicate with them, I'm referencing what they've told me, how they want to be identified. And remember that, and that there's a number of things that we can do to build accountability and to ensure that we're using accurate pronouns, right? We can do what I've just described, like always making note of someone's name and pronouns, referencing that before we speak to them. We can practice. I really encourage using they, them pronouns as often as possible. If I'm being sent out to meet with someone and I'm like, oh, this person's name is Jack, you're going to meet Jack. I'm like, okay, Jack. And I start using they, them pronouns for Jack because I don't know what Jack's pronouns are. And so I'm going to use neutral ones until I get to meet that person and they can tell me how they identify. So that's my best practice. What that does is it creates space in my brain to disassociate words like names from identities or other markers like pronouns, right? And so it's just creating a little bit of space in there for me to slow down and be able to ensure that I'm curating my care in a way that works with the people when I meet them. It's really important that you correct each other. Don't put that responsibility on your clients or your community members, certainly on other trans people. We need to really have our ears attuned for names and pronouns and make sure that we're correcting one another as quickly as possible. And you are going to mess up. I mess up sometimes. It's okay. You're going to mess up. What's really, really important is that you don't make a huge deal out of it. Trans people don't want to be misgendered. We don't want to be outed. We don't want to have like what I would describe as like that's like a kind of like not affirming, unwelcome attention. We don't want that. And I'm kind of speaking in generalizations here, and I realize that, but that's not a thing that people want, right? So don't make it all about yourself. Don't, I've had people misgender me and then they like argue with me about it, like say they didn't misgender me, or they burst into tears and start crying and hugging me. And it's like, who's comforting who? So what you want to do is say, I'm sorry, use the right pronoun and move on. You want to make that experience as small as possible. Okay. Just make sure that that person hears that you're apologizing. Just say thank you, even if you're sure you use the right pronoun. This is not a time to just like dig your heels in. Just be like, oh, I'm sorry, I misspoke. Use the correct one and move on. It's not about you, right? But it is about the people that you're of service to. And then the last concept that we're going to kind of talk about as like a foundational one is intersectionality. Hopefully everyone is familiar with this term. This was coined by Kimberly Crenshaw back in 1989. She's a Black female scholar, a feminist, and an anti-racist scholar. And she came up with this term as a way of describing Black women's experiences who are impacted by both racism as well as sexism and misogyny. And there was just not a lot of scholarship at that time that was recognizing the experiences of Black women. So her work has just been really foundational, and continues to be really important. And so she describes intersectionality as a metaphor for understanding the ways that multiple forms of inequality or disadvantage sometimes compound themselves and create obstacles that are often not understood among conventional ways of thinking, right? So thinking back to some of those earlier statistics that we were looking at, where there's these huge disparities among youth suicide attempt rates and LGBTQ youth suicide attempt rates, or LGBTQ attempt rates and trans and non-binary attempt rates, or everyone's attempt rate and then Black, Indigenous, youth of color's attempt rates, right? So that helps us understand those disparities. It also helps us understand the different risk factors or structural factors that are impacting people's lives. And also that we can't assume that someone has like a primary identity and that that's the same for everyone, right? That being LGBTQ is the most impactful aspect of a person's life. Maybe it's that they're experiencing a lot of racism or another form of discrimination. And so when we're working with folks, we just want to be able to hold the complexity of all of this in our mind, understanding that there's all of these different stressors that people can be experiencing, and that we're both assessing for these risk factors, and then we're also safety planning around them as well.
So I think one of the biggest takeaways is with intersectionality is recognizing that somebody is not just one identity. They have so many different identities that they've ascribed to, that have been assigned to them. Maybe like, if they're a parent, then maybe they're assigned the identity of mother. So it's recognizing that just because we may now know that somebody who is identifying as LGBTQ might have a higher suicidal ideation rate, doesn't mean that that's where their energy is. It doesn't mean that that's necessarily where their stress is at. So it's really evaluating all the different areas in their life as well, and seeing how all those different identities may impact another part. So maybe they are identifying as LGBTQ and at home they don't have any energy on it, but at work, if they come out at work, there could be a lot of issues. So it's just really assessing and asking how those different identities may impact other identities that they have in other places. Um, and so it's how has your mental health intersected with other experiences? Is it causing financial hardship? Is it causing a housing crisis? Is it, making it hard to socialize with people, hard to be at work? So it's asking all of those questions and seeing how the different aspects of their life may be causing stress, maybe causing mental health issues. And so we get to ask and identify and evaluate all the different areas of their life. And so as we're linking people with community resources, we need to be asking what community resources they'd be comfortable with. So are they wanting a resource that is specifically for LGBTQ folks, or maybe something that is geared towards their housing crisis, geared towards their racial identity? So asking them what is important to them, how can we support, how can we facilitate a healthy handoff to a community agency? So, a vignette. You have been dispatched to meet with Taylor, who has identified as he, him. He's a 25-year-old adult who is visibly distressed. Taylor was kicked out of his family home a month ago when his parents caught him having sex with another man. Since then, he has been using drugs and turned to survival sex work. Earlier in the day, he was sexually assaulted by a date, and he reports feeling rage, isolation, and hopelessness. So you have now engaged with Taylor. How can you approach him with sensitivity and respect for his sexual for sexuality and life circumstances while acknowledging the emotional distress that he's experiencing. If you want to take yourself off mute, if you want to answer in the chat, how can we support him with what's going on in his life? So I think one of the first things that we would do with anyone, regardless of the situation, is to empathize, right? Is to listen to their story and validate their experiences. Support with empathetic listening, absolutely. And, just being affirming with him, right? Understanding that him being kicked out of his house is probably very traumatic. And he may be experiencing a lot of those things that you guys mentioned earlier on the Mentimeter, the isolation, validation. Yeah. We want to validate his experience. We want to believe him when he says that he's having this experience. Being present. Yeah. Non-judgmental, being present. In what ways can we validate his feelings while fostering a sense of hope and safety? Active listening, creating a safe space. So it's that what a lot of other people said, being non-judgmental, validating, empathizing, and bringing all of that into allowing him to know that you're a safe person, that you're not someone who's going to judge. So even if he has turned to sex work to survive, he's a person in front of us who is in a crisis, and we get to support him. Yeah, allowing for his expression. And how can you involve Taylor in the decision-making process to ensure his cultural identity, values, and preferences are centered in the crisis response? I like that. The client is the historian. He is the expert in his own life. So he gets to share with you what his expertise is because he's the expert for him. Yeah, hear what matters most. So what does he need from us? What resources is he looking for? Does he need medical support? That might be a question. Is he feeling like he wants to hurt himself as part of our assessment and evaluation, right? Is he feeling lost and lonely and disconnected from family, from community? What community resources or supports can you connect him with? Thinking about the challenges that he's experiencing right now. So he's currently unhoused, separated from his family. Yeah, short-term goals. Yeah, what would help you now? What would help you in the immediate? And then if you think about some of the resources that you may have in your county, in your area, do you know how gender affirming they are? Do you know if those resources would be a safe space for Taylor during this time? So we have some domestic violence shelters. How many domestic violence shelters do we hear that are for female identity only, for women only? There are some that are open to all genders. So knowing that when we're linking someone to a community resource, how is that individual going to be treated at that community resource? Are they going to be further traumatized? Are they going to be further discriminated against? So it's really getting to build those relationships with the community to ensure that we're passing someone off and linking them to care that is going to be supportive and affirming and advocate for their healing and for their growth. The Trevor Project, huge. Yeah, so you want to ensure that the rapport that we built, that whole non-judgmental space that we created, is not destroyed by us linking them to a facility that is not open, that is not affirming, that may have some underlying biases. Absolutely, we do not want to re-traumatize somebody, because if something happens again next week, next month, next year, is Taylor going to call us? So we want to make sure that we're supporting Taylor. So not only for right now, but for the future also.
All right, so there are a number of different frameworks that we can use for approaching this work. So structural competency is the first one. This helps us recognize that structures and institutions shape our interactions and our interventions. trauma, and we've already talked a lot about that, right? The political climate, the way our services and programs are delivered, all of that type of thing, as well as like, the gender binary and like all of this stuff is about structures that shape our work. Trauma-informed care, right? We understand that folks bring to the encounters that we have with them that they've experienced trauma, that they may be actively experiencing trauma. We know that folks are bringing trauma to their encounters with us, and then we want to not perpetuate trauma in our encounters with them, right? So we're relying on a framework that we're supporting and uplifting safety, transparency, helping folks have choice and empowerment, and that it's a really collaborative approach to care. And then finally, cultural humility. And we're actually going to focus more on cultural humility than on cultural competency. This is, really kind of like a high kind of level interpretation, but like cultural competency, we're really focusing on the competency, the knowledge of the professional, right? And it kind of uplifts the knowledge of the professional as the expert. And what I like about cultural humility is it's a commitment to lifelong learning, self-reflection, and self-critique. We're looking to level power imbalances in our interactions and then develop mutually beneficial partnerships with the people that we're working with, right? So the three of these really fit well together. Yeah, and then here's a closer look at cultural humility, right? So the way that we uplift diversity in our work is by leveling power imbalances. And as responders, we hold the balance of power in our interactions, right? So we want to really engage in that self-reflection and self-critique and not have to rely on our clients to advocate for themselves to get the types of care that they need. We really want to advocate alongside them and be a partner with them in ensuring that they're getting appropriate care. Okay. So, and once again, I'm just going to like reiterate, it's not possible to know everything about a population. You don't need to, right? That idea is cultural competency broadly. I know it's a little bit of an oversimplification, but right, we know ourselves, we know our location, we know our biases, we know the lens that we bring to the work, we know how our clients are different than us, and we're committed to working collaboratively across that difference to create a safe and affirming encounter and care plan for the folks that we're working with. So we're going to do a little activity. I'm just going to invite folks, if you can, if you're able to please like, take a little deep breath, situate yourself where you are. If you're sitting in your chair, just kind of get comfortable. Maybe close your eyes if you don't mind, lower your gaze. And we're just going to do a little self-reflection activity about what it might be like in the day of the life of one of our LGBTQ community members that we're serving. And then after we'll have a little kind of like share out reflection. Okay, so please just take a deep breath, take a moment to situate yourself and lower your gaze. And I'm going to run through some statements here. So please take a moment to imagine, what would it be like to worry that your parents will kick you out of the house because of your gender or your sexual orientation? What would it be like to be concerned that people won't understand your identity? And at best, they might think that you're confused or misled, but more likely, they might think that you're mentally ill or a sexual predator or hellbound if they figure out who you truly are. What would it be like to experience shame, humiliation, and anger when your friends, your family, your teachers, your coworkers, your medical providers, everyone around you is repeatedly forgetting your name and pronouns? But that's a daily experience that you have. What would it be like to worry that the medical profession, your medical providers, or your mental health provider might refuse to provide you with care, or they might provide you with inappropriate care because of your gender? And what would it be like knowing that you need hospitalization or you need treatment, maybe substance use treatment, and you're worrying that you're going to have to wait hours or days or weeks, and probably people already have to wait to get the care that they need. But in this case, you have to wait even longer than another person would have to because of your gender. The institution has a policy that you need a single room. And so you have to wait for that one single room in the facility to open up. Okay, so let's come on back. What stood out for folks? Is there anything that was surprising for you or that you felt moved by as you were moving through this exercise? It would be very easy to succumb to hopelessness. Yeah, Daphne, well said. Isolation and frustration. Stress level is up. Stressed and anxious all the time. Hopelessness. Yeah. Stress, depression, fear. Yeah, like the world is against you. And so folks are already struggling, right? With like everyone that you work with is struggling, right? And now there are these extra complications that queer and trans folks, LGBTQ folks are living with and navigating and dealing with. Yeah, it's a lot. Always on heightened or elevated alert, questioning your existence alone and unseen. And so certainly this like brief activity, in this training is like nothing like what it's actually like to be transgender, right? Or like to be LGBTQ, right? It's just like a little moment of having insight. And I think that you're all demonstrating in your reflections how much it matters that in this moment of crisis, right, that you're all out there and I'm like gonna cry. I can't even cry, but like, you're out there and you're lifesavers and you are in a position to make a difference today for this person in this moment. And how much of a difference can you make, right? What is in the sphere of your influence, right? To do warm handoffs, to spend maybe a little bit of extra time to ensure that this person is connected to a service that, that it's a good connection for them and that their care team where they're going understands who this person is and how to treat them, or, that I don't know, that we're spending time networking and building relationships and understanding what LGBTQ specific resources exist in our communities, right? Where there's a DV shelter that serves everyone, right? And what their policies are in advance so that we have that information ahead of time and we can alleviate some of that apprehension. Because in my experience, working with trans people, I mean, at any level of care, but especially folks in crisis, right? It's like, and at the agency I worked at, we provided stopgap care and folks didn't want to go anywhere. They wanted to stay at our organization. They wanted to live there. They wanted to sleep on the couch. They did not want to go to a hospital. They did not want to go to a shelter. They didn't want to go anywhere because they didn't trust, because they'd been there before. It wasn't their first rodeo and they didn't want to do it again. And so if you do know and can develop partnerships with places where you can say, no, I know these folks. I know you're going to have a good experience there, then that can make a real, real difference for someone.
That was a wonderful exercise. Thank you so much for that, Alex. So coming back to mobile crisis response, how do we apply all of this to the work that we do in the field? Um, so again, the rapport building starts from the first introduction. How are you introducing yourself to the individual? For me, I am constantly evaluating spaces that I'm in to see if it's a safe space, to see if the person who I'm talking to is a safe person. So one small thing that we can do to acknowledge that we're a safe person is to add stickers to our badges, add a rainbow. When I go into a new space, I will find the tiniest little rainbow and I will identify that, and I'll identify that this is a safe space, that person is a safe person. So that's something that we can do to kind of get that head start on building rapport for the individuals that we work with. So as we're introducing ourselves, we are role modeling. We're verbally telling someone that we're a safe person as we're using pronouns, as we're introducing ourselves using our own pronouns. So it would be like, "Hi, I'm Erin. I was called out here today to work with you. My pronouns are she, her. And how about you?" And that gives someone permission to self-identify, to let you know what they want to be called, to let you know what their pronouns are. And then we get to further that conversation too. You know, depending on if we're going to a school, sometimes the school records will have, you know, their name given at birth on the record. So we ask them, so your name on your school record says this. Is this what you want me to call you? And that would be the same for anyone, whether or not our presumption, again, assuming our presumption is that they may be queer or not. If we have somebody who's Christopher, do you want me to call you Christopher or Chris? Or, you know, like what name do you want me to use? So it could be nicknames, it could be, you know, everyone has different nicknames, or it could be a name that somebody who may identify as trans or non-binary or whatever they want to be called, whatever their name is, then we get to ask that and we get to respect it. I know that there has been a lot of terms that we've learned today. Having over 1,000 terms for gender, over 1,000 terms for orientation, it's a lot. So I want you to know no one is expecting you to know everything. I think it would be extremely challenging for anyone to know everything. So if someone says that they identify in a certain way, and you like, you know, even if you think in your head, you know what that means, ask them. Okay, so you're identifying as pansexual. What does that mean to you? Because one person's definition might be different than somebody else's. And do you need to know that in order to support the person? How does your knowing that help them to maybe understand if it's a additional support that we need to link them to resources, what we need to do to further the affirming care with them, if we need to include discussing the safety plan. But in all situations, like, you know, a lot of this stuff is inside and outside of LGBTQ folks, where we're echoing back the person's own language. So that's part of the rapport building too, is mirroring. So whether or not somebody identifies on as a LGBTQ community member or not, we should be echoing their own language to further and build rapport with them. So again, while we're in the field, yeah, be curious, but no one's expecting you to know everything. So just ask. If you don't know something, ask. So that curiosity, that openness, that cultural humility that we're talking about, that is what is developing you as a safe person. That is what is allowing somebody to be open, to feel safe around you, to be able to disclose what's going on. And then just being mindful that, you know, for me and my experience, I know I don't always present as gay, and I get often your husband, and I'm like, no, a wife. And so just using gender neutral terms. So don't make assumptions about anyone. So just being very, very mindful about that. So it's asking simple questions. How do you identify? What are your pronouns? What's your sexual orientation? And can you explain to me what that means to a you? And then just being open, non-judgmental, hearing it, and then also making sure that when we're in front of the individual and we're not in front of the individual, we're still using their correct pronouns. So when we're back at the office talking about the consumer with our supervisor or with our colleagues, we're still using the correct pronouns. We're role modeling for other agencies. How do I identify this person? How do I engage with this person? What pronouns am I using? So as we're linking them to community resources, we're role modeling and we're setting the expectation. When we're in a school, Alex had mentioned that sometimes people may not be out. So if they've identified us as a safe person and they've come out to us and they have shown, like, told us, maybe some of the various ways that they identify, ask them, is it okay once I leave this room? What name do I call you by? Do your parents know? Does your school know? I want to be respectful. I don't want to out you. I don't want to put you in a dangerous situation. So just making sure that there is transparency across the board. So we're not putting them in an unsafe space. So face to face, we may be calling them by one name, and when we're out with parents or out with school, we may be calling them by a different name. So just honor that, respect that, be mindful, cautious.
Thanks for that last point, Erin. I just want to add that, it can be hard to like switch how the language that you use to talk about someone. And so, going back to some of the earlier suggestions that I had about deferring, like defaulting to they, them for people, writing down so that you have like a visual cue that you're referencing. Um, those kind of like tips and tricks just create a little bit more space, or like it's building in reminders for yourself. So if I'm needing to switch pronouns when I have a meeting with the family, I would write the pronouns that I'm using with the family to reference that young person. And so I would have that and I would be looking at that. Um, so yeah, just, really helpful to like try to use some tips and tricks to make it as easy as you can for yourself. For this terminology here, this chart comes out of a book by San Chang, who is a Bay Area clinician, and their book is called A Clinician's Guide to Gender Affirming Care. And if you do work with trans folks, this is an excellent resource. They have a significant section on documentation, and every aspect of like treatment planning, and this can be really there's several more tables like this around gender and sexuality, but I'm just showing this as an example of some more details on language that isn't affirming. And again, you want to make sure that you're communicating in an affirming way in front of your client when or community member when they're not present, as well as how you're documenting about them in the chart, right? And so this is an example of something that you could use with your clinical documentation. The column on the left is outdated. It either erases or minimizes the legitimacy of trans folks' identities. And then the column on the right are some alternatives that you can say. So earlier we discussed that gender is not the same as biological sex or sex assignment at birth. Okay, and so you can see that there's language there relating to like biology in the first couple of categories, and it's also more like male female language is often we associate more with sex or biology than we do man and woman. We also discussed that these are not binary concepts, that they exist on spectrums or galaxies or like something else, right? So the language on the left is rooting gender in biology and sex and gender as binaries. The language on the right is more expansive, right? Saying that someone was assigned male at birth creates a lot of possibility. You can something you can attach maybe to like their birth certificate or their identity document, but or some aspect of their experience, but it's not a totalizing description of who they are. It actually doesn't say who they are right now at all. And then some of this language is outdated. So the last two columns there that say M to F or male to female or F to M, female to male, those are old ways of thinking about transition. And certainly some people do still use that kind of language. Certainly some of our trans elders that might capture their experience, or other folks as well. Some people do have like a very binary understanding of their experience and their identity, and that their transition is very linear and it's fixed. It has an origin and a conclusion. But that's also like not most people's experiences. And like transition is also something that like happens over like decades. Like, it encompasses identity documents, it encompasses social aspects, it encompasses medical, or it may not encompass all or some of these aspects. right? We're seeing in the political climate right now that people are having their identity markers changed back in some cases, right? So it's never really over, it's like it's an ongoing process for a lot of people. And again, this kind of language of F to M and M to F is erasing non-binary and fluid identities. So again, we really want to make sure that we're using appropriate terms. We want to instill confidence in the clients that we're working with. We also want to demonstrate that to our colleagues and our teams and community partners. And language is a really important component of how we can do that.
This is what being culturally humble is about. When we are open to learning, when we start to know better, then we do better. And some of this may be a first time hearing for a lot of you guys. And so, as Alex said before, we are going to make mistakes. We are going to say things that might be on the avoid saying list just because that's what we've been used to. And so, but once we practice, once we start to utilize it more and more in our language, once we know better, then we do better and we're able to appropriately role model for other folks. A lot of this is learning, and that's what being culturally humble is. So, all right, vignette number 2. And honoring that we have about 10 minutes left, so we're going to go a little bit quickly through this. So you're called to assist Sam, who identifies as they, them, a 16-year-old non-binary high school student who has been experiencing bullying at school due to their gender identity and pronoun usage. Sam reports that some classmates have been misgendering them intentionally, and a teacher recently dismissed their request to use their correct pronouns, saying it was too confusing. Sam's grades have started to drop, and they have expressed feelings of hopelessness and thoughts of skipping school to avoid harassment. They share that they are not sure how their parents would react if they learned about their struggles, as their parents have made conflicting remarks about gender issues in the past. So very briefly, because there's still some stuff that we want to get to. It's just been a robust training experience. So how can you create a safe space and a supportive space for Sam to share their experiences without fear of judgment or dismissal? How can you empower Sam to advocate for themselves while also identifying trusted adults, maybe counselors or affirming teachers, who can support them at school? And how can you work collaboratively with Sam to identify strategies for managing their anxiety and building resilience in the face of ongoing challenges? So active listening. So yeah, a lot of this is kind of how we would treat any other teenager in school who is feeling dismissed, who is feeling not seen and not heard, right? But then we have a lot of adults in their life that we're working with too. So then how do we support Sam and work with the adults in their life? Brief with school resources first to know their resources. Yeah. Self-education in regards to the culture, acknowledge feelings. Yeah. So what resources are there available at school? Is there school counseling available? Is a counselor a safe person? Or is a counselor going to be confused also and too much work to try to use Sam's correct pronouns? Provide support with the parents and school staff. And I think it's educating the school staff too. And if they've seen that Sam's grades have stopped, have gone down, that's, as most of us know, that's a huge indication that something else is going on, that there's crisis happening, that the focus is being pulled away. And so a lot of this could have to do with how Sam is being treated at school. So being aware that what is going on at school could be impacting Sam's grades and impacting Sam's mental health. Yeah, what does Sam feel comfortable with? Advocate. Yeah, advocate for them. And I think also being a 16-year-old, a lot of times how often are teenagers told this is a phase? You're just trying to be different. You're just trying to stand out. You're trying to be oppositional. And maybe not. Maybe this is who Sam is. And regardless of whether or not this is a phase for Sam or not, the feelings of isolation and despair and grades going down and depression and anxiety, those are real experiences. And that's what we get to focus on. So, and then is educating the adults around him on, like, look, all the stuff that we learned earlier today on how helpful and affirming it is to have one person, one adult support them. One adult to say, I believe you and I'm here for you and I'm a safe person for you. So just being very mindful of what's going on with them and what's going on with their identity and being a safe person. So as we're looking at safety planning, I think a lot of us are very familiar with the different aspects of safety planning. So we want to continue doing the normal aspects of identifying safe people, identifying activities that they could do when they're feeling stressed or depressed or feeling isolated. Who can they call? Are there hobbies that they can do? But we also want to make sure that if we're referring them somewhere, making sure that it's a safe space, making sure, do they have safe family members or safe friends? Someone who is affirming them, someone who is engaged and is using correct pronouns, who is open to gender identity, who is open to sexual orientation, who is supportive and helpful. Finding a teacher or coworker or an ally, letting them know that when they're going in to find a therapist, they could absolutely 100% choose therapist's qualities. They could choose whether or not they want to work with a Black therapist, or they want to work with somebody who is Christian, whether they want to work with somebody who identifies as male, or if they want to work with somebody who identifies as queer. They can choose all of these aspects in a therapist. They can choose to work with a therapist who supports the LGBTQ community. And so just letting them know that like it doesn't have to be like a random like crapshoot. They can narrow down therapist search to someone who would be affirming and supportive and helpful. Also, what do you know in your community that you could refer somebody who is LGBTQ to? Have you done your research? Do you live in a university town, or maybe there's some LGBTQ clubs? Maybe the university has something on campus. Are there churches in your area that are welcoming? Are there meetups? Can you go online and find a meetup group for people who identify as LGBTQ? So it's an opportunity for all of us to do our homework before we engage with somebody. So we have options when we're working with our folks to finding like what are safe spaces. Maybe when we're doing our outreach to different places, different hospitals, different crisis stabilization centers. We're asking the question. So what happens when a trans person comes in? How do you guys typically handle that? Asking those questions. So when you're engaged with a trans person out in the world, you know what the expectation is, and you could prepare them on what it's going to end up looking like too. So in working with family members, we kind of talked a lot about this, but it's really our opportunity that we get to advocate for the individual that we're working with. So they may not be happy, they may not be thrilled with what's going on with their child. We could provide education on some of the challenges that we've seen, some of the what the statistics say. We could role model for them what it means to use correct pronouns, what it means to use their correct name, how it validates them, how it makes them feel seen and heard and safe and loved. We could also link them to places in the community like PFLAG, where they can meet with other parents who have maybe experienced similar things. That what Alex mentioned earlier, the slightest show of acceptance makes a huge positive impact for the youth.
Can I just add, Erin? I just want to say, like, no one has credibility in the mind of a parent of like a trans child, like the parent of a trans child. You just don't. None of us do, especially not someone like myself. I don't have that credibility. But yeah, so connect the parent resourcing, supporting youth is resourcing the parents. So PFLAG is such a great referral. Thank you.
Thank you for that. So it's huge. So we get to absolutely work with the parents too, and making sure that the youth is feeling safe, or maybe it's encouraging parents to continue doing a wonderful job. Their support makes a huge difference. And so these are some great resources that you could take down and provide to some of the folks that you're working with. And again, find out what your local resources are, because sometimes people need to have community where they're meeting with people face to face. Are there groups? Are there clubs? Are there meetups? Are there safe churches? Are there safe clubs? Are there youth groups? A reading club for folks? You know, anything just to have that community so we're making it less isolating. Community is hugely important. Yeah, these are all great. I would recommend that you have these on a card or something that you can hand out to folks when you're engaging people who may need some of these resources in the moment. And this can absolutely be included in their safety planning too. So these numbers are 24/7. So very helpful. Hopefully your big takeaways from today is to continually demonstrate respect, advocacy, being culturally humble. A lot of new information has come out today. So don't stress out over it. Be open. Start to implement it into your vocabulary. Start to implement it into your communications with folks out in the community, and that LGBTQ folks really do experience a lot more barriers than their cisgender or hetero counterparts. So there's a lot of discrimination, there's a lot of bias, there's a lot of additional stressors that are really coming up, like especially recently for people who are identifying in the queer community. Family is hugely important, and having that acceptance and that support. And so for us, we get to be a safe space. We get to be respectful and be accurate and honor them, honor their identity, validate, be non-judgmental, be open, and we get to also role model all of that stuff for our community partners. So when we're working with law enforcement, schools, families, hospitals, CSUs, we get to model all of this stuff and make sure that we're referring people to safe spaces too. Thank you so much for your time. Thank you for the lives that you're saving out there.
Thank you so much, everyone. It was great to be here. Thank you for your time on this topic.